Welcome to the deep dive. Today we're getting into canine coronavirus. Now, this is a topic that, often causes confusion. People mix it up with other dog illnesses, sometimes even human viruses.
That's right.
So our goal today is to really clear that up, give you the essentials you need to keep your dog safe and healthy. And just to be clear up front, we're not talking about human COVID-19
Definitely not.
or even that canine respiratory coronavirus. This is different.
Completely different. We're focusing squarely on the one that mostly affects a dog's gut, their gastrointestinal system.
Okay.
And understanding this one, it's really practical because this virus, it's surprisingly common and it spreads really easily where dogs hang out together.
Like dog parks, kennels.
Exactly. Boarding facilities, shelters, you name it. And while, yeah, most adult dogs handle it okay, it can actually be quite serious for puppies or, dogs with weaker immune systems.
Okay, so that's the hook, understanding those nuances.
Precisely. Getting a handle on it it's just smart for any dog owner.
All right, let's dive in then, starting right at the basics. What exactly is canine coronavirus, CCoV?
Okay, so CCoV is a contagious viral infection. It belongs to the alpha coronavirus group, and it's actually been known for quite a while, identified back in 1971.
71, wow. In Germany, I think.
That's the one. But the absolute key thing, the point that often gets missed, is that CCoV is distinct.
Right. You mentioned that. Distinct from
The canine respiratory coronavirus, which is CRCO, and totally distinct from SARS-CoV-2, the human COVID virus. They're different families, different effects.
Okay. So CCoV mostly stays in the gut and usually mild.
Generally, yes. Mild to moderate symptoms in healthy adult dogs. But, and this is really crucial, it doesn't always act alone.
Uh-oh. What happens then?
When it hits a dog that also gets something like canine parvovirus, well, CCoV almost acts like a preconditioner. It weakens the gut lining, making the parvovirus infection much, much worse.
Whoa. So it like opens the door for something more dangerous.
Exactly. It dramatically increases the risk of really severe, potentially life-threatening complications, especially in those young pups.
That completely changes things.
Yeah.
It's not just about CCoV being mild then. It's about its potential to amplify other threats.
You've got it. That interaction is key.
Okay, so if it's this distinct virus, but it can be, pretty common, how does it actually get around? How does it spread so well?
Well, the main route, overwhelmingly, is fecal-oral.
Meaning?
Meaning the virus is shed in an infected dog's poop and another dog ingests it somehow.
Okay. Easy to imagine with dogs sniffing everything.
Right, especially puppies exploring the world mouth first. And it spreads like wildfire in places with lots of dogs in close contact. Shelters, breeding places, pet stores, dog parks, shows.
Makes sense.
But it's not just direct dog to dog. Contaminated stuff plays a big role too. Food bowls, water dishes, bedding, floors. Even our hands, if we handle an infected dog and then another one without washing.
So surfaces matter too. Good to know. How quickly does it happen after exposure?
It's fast. The incubation period is typically just 1 to 3 days.
1 to 3 days.
Yep. And then the dog can shed the virus in their feces for potentially up to 2 weeks after they get infected. Sometimes even a bit longer.
2 weeks, even if they seem okay.
Even if the symptoms have cleared up. That's why hygiene and isolation are so important if you know a dog has it. There's that window for silent spread.
That mental image of puppies tasting everything, plus the 2-week shedding. Yeah, that definitely drives home how careful you need to be.
Absolutely.
So let's talk about what it looks like. If a dog does get CCoV, what symptoms should you as an owner be watching for?
Right. So the signs can vary quite a bit. Depends on the dog's age, their overall immune health, and critically whether any other infections are playing along.
Like the parvo situation you mentioned.
Exactly. But focusing just on CCoV first, the most common signs are gastrointestinal. Think diarrhea.
Okay, what kind?
It's often sudden, usually mild to moderate. The consistency can be watery. Sometimes it has this kind of yellow-orange color, and occasionally you might see streaks of blood or mucus.
Yellow-orange, interesting.
What else? Maybe some vomiting. Again, usually mild to moderate. Loss of appetite is pretty common. They just don't want to eat. And lethargy.
Just seeming tired or down?
Yeah, listless, maybe a bit depressed. Not their usual bouncy self. Some dogs might show abdominal pain, like they flinch or seem uncomfortable if you touch their belly.
And dehydration must be a risk with the diarrhea and vomiting?
Oh, absolutely. That's a big concern, especially in puppies. They can get dehydrated really quickly, and that's serious.
Okay. Are there other, non-gut symptoms?
Sometimes you might see a mild fever, but usually not high. The really severe systemic signs, high fever, really bad bloody diarrhea, shock, potential sepsis, that's usually when CCO has teamed up with something like parvo.
Right, the co-infection danger zone again.
Exactly. And one more thing, it's really important to remember that many healthy adult dogs might get infected and show no signs at all, or maybe just like one day of slightly loose stool that you barely notice.
All symptomatic carriers.
Precisely. They can still shed the virus and spread it, even if they look perfectly fine.
That's tricky, especially for places like dog parks or daycare. A seemingly healthy dog could be spreading it.
It really underscores the challenge, yeah.
So, okay, given that the symptoms can be kind of vague, diarrhea, vomiting, lethargy, could be lots of things, how do veterinarians actually pinpoint CCoV? How do they figure out this is the culprit?
That's where the detective work comes in. It really starts with a good history from you, the owner.
Like what?
Like, has the dog been around other dogs recently? Boarded? New puppy in the house? Dog shows? Stuff like that. The dog's age is also a big clue, since puppies are more susceptible. Then a thorough physical exam.
Okay, history and exam first, then tests.
Then lab tests, yes. A very common one is a fecal ELISA test. It's pretty quick, looks for CCoV antigens, basically, bits of the virus directly in a stool sample.
Like a rapid test.
Sort of, yeah. Gives you a reasonably fast answer. For, let's say, higher accuracy and more detail, there's the RT-PCR test.
PCR, like for COVID.
Similar technology, yes. Reverse transcriptase polymerase chain reaction. It's very sensitive and specific, detects the virus's actual genetic material, its RNA, in the feces. It can even sometimes tell different strains apart, like the gut version versus the respiratory one.
Wow, okay, so that's pretty definitive.
It's considered the gold standard for detection, yes. There are other methods like looking directly with an electron microscope or checking blood for antibodies, but those are less common for diagnosing an active acute infection.
Gotcha. But you said the symptoms overlap with other things.
Right. So a huge part of the process is differential diagnosis, ruling out other possibilities.
What else looks like CCoV?
Well, the big one we keep mentioning is canine parvovirus, CPV. Much more severe, often very bloody diarrhea, high risk of sepsis. Vets need to rule that out quickly.
Definitely.
Then there's Giardia. That's a common parasite. Bacterial infections like Salmonella or Campylobacter. And just your, everyday intestinal worms, roundworms, hookworms, whipworms, they can all cause similar gut upset.
So the testing isn't just for CCoV, it's also to make sure it's not something else, potentially worse.
Absolutely critical. You need the full picture.
Okay, makes sense. So let's say the vet confirms it is CCoV. What happens next? What's the treatment plan? Is there like a specific CCoV medicine?
That's the million-dollar question, isn't it? And the answer, unfortunately, is no. There is no specific antiviral drug that targets canine coronavirus effectively.
So no Tamiflu for dogs with CCoV.
Pretty much, yeah. Treatment is all about supportive care, managing the symptoms, preventing complications like dehydration, and letting the dog's immune system fight off the virus.
Okay, what does supportive care look like?
Fluids are number one, absolutely crucial, especially if there's vomiting or significant diarrhea. Depending on how dehydrated the dog is, that might mean fluids under the skin, subcutaneous, or if it's more severe, intravenous fluids and IV drip.
Right, rehydrating them.
Exactly. And replacing electrolytes lost through the diarrhea and vomiting. Then, nutritional support. Often, vets will recommend switching to a very bland, easily digestible diet for a while.
Like the classic boiled chicken and rice.
That's the one. Helps rest the gut while still providing calories. Once things firm up, you gradually transition back to their normal food.
Okay. What about treating the symptoms directly, like the diarrhea or vomiting?
Yeah, symptomatic treatment is common. For diarrhea, sometimes anti-diarrheal meds like kale and pectin might be used, or probiotics to help restore gut balance. Though some vets prefer to let the diarrhea run its course to clear the virus, unless it's really severe.
And the vomiting.
For vomiting, there are good antiemetic drugs, like meropitant, the brand name is often Serenia. They can really help stop the nausea and vomiting, which also helps prevent further dehydration.
So drugs to stop the puking.
Basically, yeah. Now, antibiotics. This is important. They are only used if the vet suspects a secondary bacterial infection has set in or if there's risk of sepsis. Antibiotics do nothing against the virus itself.
Right, only for bacteria sneaking in.
Precisely. And sometimes, if the dog seems really uncomfortable, mild pain relief might be considered for belly pain, but always under vet supervision.
Got it. And what about stopping the spread while the dog is sick?
Huge point. Isolation is key. Keep the infected dog completely separate from other dogs. Different bowls, bedding, potty area if possible.
For how long?
For at least 2 weeks after the symptoms have completely gone away, because remember that shedding period we talked about?
Right, the silent spread potential.
Exactly. And strict hygiene. Disinfect everything the dog touches: floors, crates, bowls, toys with a cleaner that specifically says it kills viruses, virucide. And wash your hands thoroughly every time you handle the sick dog or their things.
Okay, isolation, disinfection, hand washing. Seems crucial. So what's the outlook usually? Do most dogs recover okay?
For most healthy adult dogs, yes, the prognosis is excellent. The symptoms usually clear up within, say, 2 to 10 days with that supportive care. They bounce back pretty well.
That's good news.
It is. However, for puppies or dogs that are already immunocompromised for some other reason, the prognosis is more guarded. They need much closer monitoring, often more intensive care, like hospitalization with IV fluids.
And if it's one of those co-infections with parvo?
Then the prognosis becomes much more serious, definitely guarded to poor depending on severity. Prompt, aggressive veterinary treatment is absolutely vital in those cases.
Really highlights the vulnerability of puppies.
Okay, so recovery is usually good for adults. What about preventing it in the first place? Can you stop your dog from ever getting CCoV? Is there a vaccine? There is a vaccine available for canine coronavirus.
Oh, so why isn't it like standard for all dogs, like rabies or distemper?
Good question. It's generally not considered a core vaccine by major veterinary organizations like AAHA, the American Animal Hospital Association.
Why not?
A few reasons. One, as we've said, the disease is often mild in healthy adults. Two, the vaccine doesn't necessarily provide complete immunity. It doesn't always stop infection or shedding entirely. What it mostly does is reduce the severity of the symptoms if the dog does get exposed.
Okay, so it lessens the illness, doesn't totally block it.
Right, so it's typically recommended more for dogs in high-risk situations.
Like those places you mentioned before.
Exactly. Shelters, large breeding kennels, dogs that frequently go to shows or competitive events, places where exposure risk is high and the consequences of an outbreak, maybe alongside other diseases, could be significant. For the average pet dog, the risk-benefit calculation often leads vets to say it's not essential.
That makes sense. So besides the vaccine for high-risk dogs, what else can we do for prevention?
Environmental control is huge. Regular cleaning and disinfection of kennels, bowls, and common areas, especially if you have multiple dogs or dogs coming and going. Prompt and hygienic cleanup of any dog waste is critical. Bag it and bin it immediately.
Good park etiquette is actually disease prevention.
It really is. And another good practice, especially if you're bringing in a new dog or your dog is returning from a high-risk place like boarding, is to maybe keep them slightly separate for a few days, a sort of mini quarantine, just to watch for any signs of illness before they mingle closely with your other pets.
Simple steps, but sound effective. Okay, so let's try and wrap this up. The main takeaway seems to be CCoV, canine coronavirus. It's this generally mild gut virus in most dogs, but it's super contagious.
Right, spreads easily.
But the real danger kicks in with puppies, immunocompromised dogs, or especially when it hits alongside other nasty bugs like parvo. Then it becomes that preconditioner you mentioned, making things much worse.
That's the key vulnerability, yeah.
So recognizing the signs early, getting that vet diagnosis, and focusing on supportive care, fluids, nutrition, managing symptoms, that's the path to recovery.
Absolutely. And prevention through hygiene, careful management in group settings, and targeted vaccination for those at higher risk.
Excellent. Really helpful clarification.
Good. And maybe just one final thought to leave folks with. Considering how easily CCoV spreads, often without obvious symptoms, and how it can seriously complicate other common dog diseases, what does that really tell us about sort of the interconnectedness of dog health in shared spaces?
Like how one person's actions impact everyone.
Kind of, yeah. How might our vigilance in preventing what seems like a mild illness, picking up poop promptly, maybe skipping the dog park if your dog has mild diarrhea, how might those simple things actually have a much bigger ripple effect, protecting the health of the whole dog community, especially those most vulnerable pups? Something to think about.